at anatomy exams mastery class or master class. We're looking at some explorable lessons, okay, from Ali Express. Okay, Ali explains. Okay, what are some lessons we can extract from the trendy Ali explains? Okay, because the same people who are watching, okay, are getting entertained by Ali Express at night are the people who are supposed to be studying. Some are, some really do in the day. So what are we going to do? We're going to see how we are going to make sure that we extract some lessons there. So while we are studying and we are learning and we are educating, okay, with anatomy or any other course we want to do or a certain topic, we'll be able to see how it applies to this. So 20 of them before we practically begin the exercise. It's going to be a wonderful time so that we are going to have, watch this now, we're going to have a better retentive smart strategy that's going to help us to have exams confidence for maximum result as we lay this study foundation. All right, so look at it. Retention smart strategies, explorable lessons for anatomy mastery. Now learn like Ali explains. Okay, learn like Ali, explore like a top student, and retain for life. There are just some things, if you learn, that's the truth. If you learn it and load it very well, you can always retain it for life. You know that very well. So that's what we are going to do now. Now watch this. We said, number one, these are the group it into three: retentive smart strategy, what to do in anatomy, and how it relates to Ali Express. Number one, predict before learning. Predict before learning. Yeah, what do you want to learn? Predict it. Like now, for example, we are going to look at upper limb, lower limb, thorax, abdomen, pelvis, and perineum, head and neck. Yes, this head and this neck. The whole of this is neck, is head, and then this is neck. All right, the top is from here, it's a region between here and here, and then the upper limb, and then the lower limb. See the leg, the lower limb. Okay, so that's it. Predict what you want to learn. So predict it before learning. Like today, you want to start from bones. Want to start from bones. We've started with muscles the other day. Want to pick bones. So muscle and bone, muscle and bone. That's what we'll be picking: muscle and bone, then spaces and plexus and things like that. And then when you predict before learning, what do you do in anatomy? Look at the topic. Like we've said, bones, okay, and muscle in upper and lower limb. Look at bone of the upper limb. Look at muscles of the lower limb. Okay, or muscles of the upper limb and bone of the lower limb, whichever one we pick. And then the next one we are looking at is the curiosity. The next one we are looking at is how does it relate to Ali explain. He says preview to activate curiosity and attention. Are you seeing that? You preview to activate curiosity and attention. The next thing very important is that is you preview. You preview, that's you view it, okay, before it's the main time, to activate curiosity and attention. Now, we have some things we are going to look at before we now give you a summary. I've done a summary, for example, for bones, okay, all the bones in the upper and lower limb. I've done a summary of it, and I'm going to show you, but they have to be a preview of textbook, a preview of one or two material, just to build that period of 1 hour. The next one is, we said, find the purpose. Ask, why does this muscle or nerve exist? What problem does it solve? Do you follow? So we are going to find purpose. We look at bones and muscle. Thank God. The next thing we're going to see, what's the purpose of bone? Okay, we're going to look at the mnemonic. Remember, we're talking about smart and beta retentive strategies to be able to master motivation. Now, why do you learn? Okay, why do you learn? You learn so that you be able to earn. Okay, you earn confidence, and this confidence, we try to track it by making sure that we give you opportunity to teach. We said you remember 90% of what you teach, and then you forget 90% of what you read. Okay, so to be ready, you must read to reshare, you must read to recite, you must read to help tell someone, teach someone. That's how we work it. Do you follow? All right. Drop in the comment section if you are following what we are doing. Very important. The next one is compare similar structure. Now, if you are looking at bones, all right, you see how some subtopic in bones relate with muscle, okay, relate with nerve, relate with other structures that we'll be talking about. So that's what we mean by compare. Now, what to do in anatomy? Compare the radius with ulna. As if you're introducing, all bones have similar introduction. Okay, you're going to see it. All bones have similar introduction. Okay, all arteries have similar nomenclature. Okay, like that. So how does this relate to Ali explain? Ali uses, he compares ideas to build clarity and understanding. He compares ideas to build clarity and understanding. So I'll take the next one or two and then we will pause it. This is going to be dropped in the channel, so you have your time to go through it and to read through it. Okay, smart strategies, retentive strategies that we explore in from pieces of anatomy that Ali explains. That's one training wonders that we are using. So as someone is enjoying a lovely, and there's another thing we do. We say turn captivating story. For here in this channel, we turn it to music in the background. There are some of the things we learn which will drop a brief summary of it with the music, like the calendar for bones we are going to drop, okay, for lower limb, and the one for tap, whatever we are doing, we drop something like this, but we drop a music in the background, music that is trending, music that you like. So maybe if you are Christian music, Christian music, or maybe you are a secular fellow, no, secular music. As you are listening to the music, you are enjoying it, and you're also marking mastery. That's what we mean, turn it into a story, and you should be able to tell the story, because stories are things you use in learning. All right, let's look at another one. And make every region a story. Are you seeing it now? Axilla is a story of 4 walls and content. That is reducing the whole of the complex thing to a single sentence of story. Okay, how does that apply to this apply? How does this telling story apply? I said it turns complex topics into similar story. Now, it's already 2:45 by my time, so I won't want to go ahead with this session. Like I promised, I'm going to drop all this for you to learn something. A lot for us to learn. A lot for us to learn. This is one is very important. But the key word of it is that, watch this now. The key word is that their lead formula for anatomy story mastery is curiosity, understand, apply, teach, and recall. Curiosity involves preview. Understand means deep learning. We need to show you picture, need to make screen recording for you. Now apply, use it. Don't just study and go. Share with someone. Use it to discuss. If there's nobody to discuss with, come to the comment section. Check the YouTube, they made such course WhatsApp channel, and then you find the studio, the group to the studio there. You join and discuss. You can DM me. All right. Next one, we talk about teach others. Gone are the days they said when you teach others they know more than you. Not lie. The problem is people teach one thing over and over to so many people several at times. Now, when you teach one thing, okay, you learn another thing and teach that one. When you're done, you record the other one. You discuss, you gist. Do you get? That's the thing. So, ladies and gentlemen, let me pause here and we dive into upper and lower limb. We dive into tap and then we get to head and neck. This is the 2nd of August, and we promise ourselves that we are going to add head and neck to tap and thorax, and we are beginning with upper and lower limb. So within the next few minutes, we'll be perusing upper and lower limb, followed by tap and next few minutes, and then later. Remember, we are taking in piecemeal. Pieces here, pieces here, pieces here. All right? So don't forget, use this everyday strategy. Said pick 5 to 7 strategy per study session. Is that not what we are doing? We are picking just a little. It's not just having so much to do, so much strategy, and then you cannot apply anyone. Like for example, they say one say test before reviewing or test after reviewing. They say recall every 10 minutes, things like that. And that's some of the things we do in this channel. Are you following it now? Thumbs up if you are with me. drop in the comment section if you are following. Subscribe and like and share this channel so it gets to a team of so many medical students. In fact, there's even another one I did which you're going to enjoy it in the evening. There's another one I did, and that you're going to enjoy it in the evening by 9 p.m. Please don't miss the session for anything. 9 p.m. we're going to have a session where we learn, okay, from the students who are lazy, but they need the trick. How do you turn your laziness to making you have greater results? Students, so you can't miss any of our session because we try to bring in lovely in motivation to help in your situation. Whether you are average student, you are afraid or shy or not confident, or your distinction and you are being challenged, whatever is the situation, we have tried to arrange a whole lot to make sure you have a wonderful time. Do you follow? Thumbs up if you are with me. All right, thank you very much. I think I've opened the message channel so you can drop a message. Thank you very much for the thumbs up. Okay, so we're gonna get Jack back into this thing now. Okay. Just before we go in, I just recall I need to pick one or two things. Number one thing we are going to pick is 10-minute pause. It means that's when we learn like 10 minutes to 15 minutes, we pause. And number two thing is we take a test. We take a test. We try to recall what we've learned. And then number three strategy we're going to learn from Ali explain, okay, is observe before memorizing. Observe before memorizing. Okay, that might not really be practical. So let's pick this one. Teach an imaginary student. Teach and imaginary student. So we are going to have time for that. While I teach you, I've not seen you because you're not a guest. It's night session. We usually have a guest, okay? But I might be doing real teaching, and then live session maybe later on. Okay, might create another session for live session. But so teach an imaginary student. And then another one, say number 4, create your mnemonics. Create your mnemonics. Now, the mnemonics we create here, we've shown you in a video, okay, how to create mnemonics. Now, but if you don't want to waste your time, maybe you're having exam, because we said exams masterclass, exams focus, exploring some trick, okay, you can use the one we do. But if you must use it, you must keep using it. Remember, we said once you don't use, remember what we said? We said once you don't use, you lose. So we have to keep using it. Okay, like I promised, I'm going to send this across to you, but let's get to study. I'm going to send this in the channel like a short. Okay, so watch it, share it. All right, so let's pause now and continue. Wonderful retentive smart strategy that can help you if you're having an exam the next 1 week, the next 3 days, the next 2 weeks, the next 1 month, the next one semester, whatever is the case. This is, you are through. Just give me 5 seconds and I bring you into what we have for upper and lower limb, for tab, and for head and neck. Oh, sorry, my voice recorder. Welcome. This is upper and lower limb. I've timed myself by starting 2:53 for upper and lower limb. The next 10 to 15 minutes, we are going to take a pause. We are going to take a test. All right. In case you are not there when we did the Zoom meeting, okay, or the Google Meet on this concept, no problem. Now, to study upper and lower limb, please listen closely. We have 48 topics. 48 topics. Out of these 48 topics, we said there are about 23, to be specific. 23 topics we are using a case study of a Nigerian university, okay, Nigerian university, okay, and their medical college course outline for the first in coursework. That's your second year of doing medicine, okay. All those doing anatomy and they are in their second year, okay, first semester, whether you're in medicine and surgery or you're in nursing, pharmacy, or what other para preclinical class, and you're doing anatomy. We said you have about 23 topics to do, all right, on joint and bones. Bones alone is 13, joint is 10. So but we reduce the whole 13 topics to what? To just one topic, which is bone. How? If you are asked questions in theory to write on bone, which is the past question, okay, circulating questions in first in courses across, they ask them question on joints, they ask them question on bones. They can ask them, you may not know the bone they will ask, but they will always ask about, even if it's one bone they will ask, even if it's one joint they will ask, but they always ask. All right. So, and we've given you we are here to give you a hint. One sentence and you remember all the subtopic you need when you are describing bones. One of the things we just learned in Ali Explained, when we're exploring Ali Explains, how Ali, okay, retentive applicable retentive strategies from Ali Explained, the most trendy stuff, okay, people watch at night, because they watch at night, want to use it to apply in their own anatomy. And then if you're a religious type, maybe football fan, or we are still coming to that, every day come with its newbies, new challenging thing to relate anatomy, which is not interesting, with what is interesting, your football, your match, okay, your entertainment, your movie, and the most trending song and all that. We try to use all these principles to make you like this one. Now we are going to drop it on YouTube. Okay, we're going to drop it on this channel. We're going to drop it on this channel. 1 second, please. We're going to drop it on this channel. This particular thing may say, I want to copy it. How do I share it to my friend? I'm going to send it to you. I'm going to drop it as a short. You're going to see. Now, let's get straight to point. We said 253, and we are starting anatomy 256. The others will just talk. Okay, bones. To study bone, if they say write on the gross anatomy of bones, there are several kinds of bones. For example, clavicle, that's this bone in the collar neck. All right, you're going to see pictures of that in consequent sessions. Okay, clavicle, then scapula. Scapula is the backbone, the shoulder blade. Okay, shoulder blade. The humerus, that's the bone between the elbow and the shoulder joint. Elbow joint, okay, can see this is the elbow joint. Okay, this place now is the elbow joint and the shoulder joint. Okay, so that place, remember, there was a time we used a strategy. We said the best textbook is yourself. The best textbook is yourself. Do you follow? The best textbook is yourself, and that is very important. Okay, the best textbook. So as I'm talking to you, I'm also touching myself. So as you are listening to me, you should also touch yourself, because if you look at the best textbook at yourself, guess what? You're going to have a nice time. You're going to have a nice time. Okay. All right, so let's continue. Okay, I needed to use this media. Okay, let me undo this thing. Okay, so that if I turn, this thing will turn, and if I turn, this thing will turn. Are you following it now? Good. So because the other one I was having issue. All right. So thank you. So we are saying this is bone. This is bone, and when you're discussing bone, all bones in the body, whether clavicle as the shoulder bone or scapula, the clavicle, that's collarbone, sorry, scapula, shoulder bone or shoulder blade, humerus, the bone between the shoulder joint, and sorry, the shoulder joint is shoulder joint now, and the elbow joint, or the radius, the bone, okay, by the lateral side. Okay, lateral means away from, all right, away from the median plane. Okay, so the bone that's between the joint and the wrist. Okay, there are two bones there. We have the radius and we have the ulna. Now both bones are between the radius and between the wrist and the elbow joint. Now watch this. Whichever bone, whether those bones or the carpus bones are the bones in the wrist. The bones in the wrist. Metacarpus are the bones here, okay, the bones here, and then the phalanges, these are the bones here, the bones here. Okay, tarsus, all the things I showed you in the hand, tarsus is homologous to carpus. So if you are introducing bones, right, you can introduce bone by saying this bone is homologous to this other bone. This bone in the upper limb is homologous to the bone in the lower limb. Now watch again, we said introduction. So but that's not really what I wanted to tell you. I just wanted to show you some bones that are in the human body. This is very important so that if you are going for clinical posting in the hospital and a case comes, okay, you should be able to tell which bone is having issue, which bone is missing, and which bone is having issue. So you can see metatarsus in the lower limb, okay, metacarpus in the upper limb. All right, all right. All right, so the foot phalanges, okay, in the lower limb, the hand phalanges in the upper limb. Now, these are not all the bones in the lower limb, but they are interest for the meantime. We're starting with the upper limb. Maybe the next session by tomorrow, God's Now Life, we'll be looking at the lower limb. Okay, please always be checking up on this channel because of my varying itinerary. Okay, yesterday I needed to take a rest because I've been giving talk and trainings all over till I almost lost my voice. So I needed to take up a time off to rest and recuperate and then prepare for our wonderful subscribers and viewers. All right, now, so that's that about the bones. All right, there are about 120 bones, okay, in the human upper and lower limbs, with excluding the thorax. All right, the thorax, abdomen, and pelvis and perineum. So the upper and lower limb, that's what you write exams on. You should be able to reduce it to a piece of paper by the time we have table of values. So this is bone table of values, and then the first thing we want to learn is we've learned the different bones. Now take a few seconds and ask yourself, how many bones can I list? Just take 5 seconds, 5 seconds. I'm going to count like 30 seconds. And then you're going to close your eye. You're going to take your book and take your eye away from this screen, shared screen, and then try to ask, how many bones can you recall? Now, it may be simpler question, but it's very important. You may be surprised. Someone is going for a 4th year exams and does not know a single bone. They say, go and pick clavicle. He does not know a clavicle. All right? Go and pick scapula. He has no idea what a scapula is like. Okay, they can say, what's another name for clavicle? He does not know. And we've said here collarbone. They say mention 10 bones, you know, in the upper and lower. He cannot tell. So that's how important, because this is viva exam. This is oral exam. It's not only the written one. The written one, yes, you can understand, observe, recall, memorize. But how about the other muscles? Sorry, the other, the oral one. So that's why we are doing this. So I'm going to count up to 30 now. All right. Now, as I'm counting, forget about my counting. Take out time and mention some of the bones. In fact, take a book, write it out. Okay, write it out, or go to the comment section, put it down there. Okay, let's be sure we are working together. At least you learn to list some bones out of this out of the 60 pairs of bones. All right, out of the 60 pairs of bone in the upper and lower limb. All right, we are doing what we have been able to mention about a few. So my counting starts now. 1, 2, 3. Have you been able to write any bone? 4, 5, 6, 7, 8, 9, Have you been able to write any bones? Just write. Don't just mention it. Write. Don't feel it's too simple. It's too small. Remember we are saying building strong foundation. Small from small. Before you know, we get to big things. Start hearing strange words in this same concept. Okay. 8, 9, 10, 11, 12, 13, 14, 15. I'm going on 16, 17, 18. How many can you write? How many bones can you list? 20, 21, 22, 23, 24. 25, going, 5 seconds remaining, 26, 27, 28, 29, 30, good. Now, if you were able to mention bone like clavicle or the collarbone, thumbs up. If you're able to mention bone like shoulder or scapula, shoulder blade or scapula, thumbs up. If you're able to mention humerus or brachial bone, brachial, thumbs up. If you're able to mention ulna or radius, okay, thumbs up. If you're able to mention carpus or carpal bones, thumbs up. Be able to mention, oh, somebody said, but carpal bone, is it just one bone? No, it's not just one bone. It's about 8 bones. To be specific, 8 bones are there in the carpus, this rix region. Okay, there are 8 bones there. All right. And the money some people use is that she likes to play try to catch her, whereas me, I use some leaders try position that they cannot handle. You know, there are some leaders, especially in some sub-Saharan region of African country, they aim for position politically, but they give them that position, they cannot maximize that position to make life palatable and transforming from the citizens. So it's the same thing even in some homes. You see some children say, I want so much food. When you give them that food, they waste it. They try some palatable food that they can't handle. Do you see now? So we put anatomy side by side. Okay. So that's just by the way. That's just, don't worry, when we come to talk about this bone, we pick it in details. All right. Don't forget today we've learned some bones. In the past few minutes, we've learned some bones. Now we want to learn the acronym, that is the mnemonics. Okay, mnemonics is different from acronym. Mnemonics, these mnemonics will help you to recall the basic point you want to learn about bone. Okay, so we start. I draw perfect picture. I hope you're writing. We're going to start it again. All right, take note. Don't assume, oh, it's there, I'll always find. You write to push the knowledge to long-term memory. Okay, you listen to face one course until you succeed. All right, we move on. So we said, okay, I draw perfect picture showing some big, mysterious brown lion on jasper field, excluding sparkling cities. Okay, that's 16 points. 16 points. If you check, all I said is not here. Okay, it's 15 that is here. What is not there is jasper. Jasper is not there. Excluding is not there. Sparkling is not there. Okay, so that's why I said you should write down. Oh, you didn't think that. Okay, so I'm going to say that again. Number one, I write it vertically. I draw perfect picture showing some big, mysterious brown lion on jasper. This is what is not here, so take note. Jasper field, excluding sparkling cities. Good. Now, just a little correction. This blessed standing for bossa is not in bones, it's in joint. So that's a mistake there. So before we send it across as a shot with a lovely background music to help you, okay, retain what you just learned about the mnemonics, we are going to make the correction. Do you follow? Thumbs up if you are with me. Drop in the comment section if you are following. I would like to read your comments, okay? Yeah, thank you very much. So we continue. All right, so we said I stands for introduction. Draw stands for diagram. Just write like that. I, okay, so there's a column for mnemonics. There's another column for what the mnemonic stands for. We call it outline. So if you're asked to write on the gross anatomy of any bone, All right, this is the anatomy hack. This is the trick. This is the technique. And guess what? All the bones, all right, have comparative, all right, outline. That is, if you know one bone very well, maybe say clavicle, okay, then you can know scapula very well. If you know humerus very well, you can know femur very well. Femur is in the lower limb. If you know scapula very well, you can know the hip bone very well because they are homologous, meaning they are in the same side or family. This one is in upper limb, this one is in lower limb. Okay? All right. Do you follow? Thumbs up if you are with me. Drop in the comment section. Subscribe, like, share this channel if you are getting blessed. Okay. So I stands for introduction. Excuse me, let me take some water. This is one of the things we say you should do, medicated water. Okay. Thank you. You take water and then even if it's not medicated water, you can still take ordinary water. All right. So we move on. We said I stands for introduction. Draw stands for diagram. All right. Perfect stands for parts. Picture. Okay, let me be a bit slow so you can take note. I stands for introduction. Draw stands for diagram. So write fast. Make you write fast. Okay. Perfect stands for parts. P-A-R-T. The parts of the bone parts. Okay. Picture stands for position. Okay. You should be able to know this bone. Is it the left side or the right side? You know, we said there are about 60 pairs of bone, meaning the one you have in one side, the left side, okay, you also have its pair, its counterpart in the right side, all right? So very important. They can drop a bone in your steeple chest, all right? And they said, this bone, tell us, is it the left side of this type of bone or is it the right side? In fact, they can even ask you, is it a female bone? This bone you are picking, is it a male bone or a female bone? All right. So you should know there are some bones that they just want you to know without too much stress, and you know by practice. We say practice bring improvement and bring perfect. Okay, so that's that about position. Sorry, I'm explaining it. I shouldn't have explained. I should just list what the mnemonic stands for. Okay. Then we like a look at the books. So we said I draw a perfect picture. What does that mean? I for introduction, draw for drawing, perfect for parts, picture for position. Okay. Now showing stands for what? It stands for surface. Okay. Some stands for what? Side determination. I draw a perfect picture showing some big mysterious brown lion. Big stands for border. All right. Mysterious stands for muscles. Are you seeing it now? Muscles. Okay. Muscles is a topic on its own, but much more. Muscle is also a subtopic. So when you write on bone, you should mention which muscles are attached to that bones. Okay. Which muscles aid the movement of that bone. That's very important. Move to the next one. Okay. Brown stands for blood supply. The other B stands for border. This other B, okay, stands for blood supply. The lion stands for ligament. This ligament, when you are writing on ligament in exams or joint in exams, you must talk about the blood supply. You must talk about the muscle. You must talk about the ligament. You must talk about the nerve. All right. Okay. The next one is on. That on there stands for ossification center. The on stands for ossification center. Jasper, which is not here, Jasper stands for what? Joint. Bone don't stand on themselves. They stand with others. They meet with others. And that meeting point is called joint. Okay? The different kinds. Now we said field stands for femoral. Stands for features. And every bone has special features. Okay, special features. Okay, and there stands for anterior surface, articular surface. Articular surface. All right, and then articular surface. Let's look at the next one. On Jasper field, excluding sparkling cities. So excluding stands for ends, or what you call extremity. Ends is spelled E-N-D-S. That's the upper end and the lower end. What some people call upper extremity and lower extremity. Some people call it what? Some people call it upper diaphysis. Okay, that's proximal diaphysis and distal diaphysis. Whatever it is called, ends is ends. The next one is is it ends, sparkling. Sparkling there stands for shaft. Every bone has a shaft except some short bones. Some short bones. Every bone has a shaft. The region between the head and the, I don't really want to call it the tail, but let's call it the end, between the upper end and the lower end. Do you follow? Thumbs up if you are with me. Okay, so we move on. Drop in the comment section if you are with me. Okay, so with this now we come to the mnemonics, an acronym for bones. So quickly we want to pause there and see how to recall. So we're going to pause and give you once again 30 seconds to say from your book, say it out, all right? Say from your book. Then you also close the book and say it from your brain, from the book, from the brain. That's how we push it from book to brain. Are you seeing it now? Okay, so your time starts now and I'm checking. 30 seconds, try to read it out. Okay, try to write it out from the book. Okay, you are not, you just are fast, write fast. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15, 21, 22, 23, still counting. Yes, I'm still counting. Try to say from your book. Okay, I believe you must have been done reading from your book now. Now let's try saying it from your brain. Try saying it from your brain. Okay? Remember, one of the things we learned from Ali Explain is to teach, watch this now, is to teach an imaginary student. So you are teaching an imaginary student now. Yeah, wherever you are, try to say it from your mouth. Teach what you've learned so far. I'm giving you like 20 seconds. I'm counting, my timer is counting. After that, I'll be with you. All right. So I want to believe that you're done. I want to believe you're done. Okay. Trying to, where do we start from? We listed the bones. Okay. Now that we are starting, please start to, please, because this is a series, this episode, these seasons. We have a whole little things to do. So the first thing we said, we listed the bones. We listed the bones of the upper and lower limb. The next thing we did was the mnemonics, okay, for outline. Mnemonics for outline, for answering, okay, questions in anatomy. Okay, hope you are together now. Thumbs up if you are with me. Okay, so the next thing we move away from there is we talk about, we pick a bone. Want to pick a bone, okay? And the bone we're picking is the clavicle. That's the first bone we are picking. So in a moment now, see now we've learned for 10 to 15 minutes, we pause, we test ourselves. If you are not testing yourself, pause, test yourself, then continue. All right? All right. That's how you do it. You walk by walking.